If you are experiencing joint pain, you're not alone. After a year of our, well, laid-back lifestyle, a lot of people are having bone, joint, muscle issues. I'm going to talk to a surgeon about this, about what we can do and why there's a backlog of joint surgeries. Here is yet another way the COVID pandemic has affected us by creating an epidemic of bone, joint, and muscle issues here in the U.S. Research shows many are suffering from increased pain, and experts say there's a big backlog of surgeries now. Let's find out more. We have Dr. Richard Berger, an orthopedic surgeon at Midwest Orthopedics at Rush, joining us. Thank you for being here.
Thank you for having me. It's a delight.
So we've heard that people are just not moving around as much, and it's estimated daily steps dropped on average by half since the pandemic started. How is that more sedentary lifestyle affecting our joints and our muscles?
So inactivity has been very unkind to our hip and knee arthritic patients. You know, a lot of pain relief happens from just moving around, staying active, keeping the joint lubrication going, keeping your muscles strong, and keeping your weight off. The inactivity of the past 1 year has been really terrible and affecting all those. Inactivity slows down the lubrication. We've all gotten a little weaker. Many of us have put on a little bit of weight. And all those things have made it much worse for patients with hip and knee arthritis.
And so they're experiencing more pain now?
They're experiencing a lot more pain now, a lot. That inactivity has really forced them to have a lot more pain. In addition, lots of those patients were scheduled to have surgery. And because we stopped surgery for 2 months, and then lots of patients were worried about having surgery, coming into the hospital, being involved with healthcare in general, they've put off those surgeries for a long time now. Now we're seeing a backlog of patients. Estimated in the U.S., there's up to 1 million patients who didn't get surgery this past year, who now we're going to have to accommodate. So my surgery calendar is filled, and we're working overtime, scheduling more patients per day, more OR days, even working weekends to try to help accommodate those patients.
Wow, and I'm assuming for the patient who's maybe put off this surgery that they need, does their situation get worse in the meantime?
It does, unfortunately. You get weaker, you tend to gain more weight, which makes the rehabilitation harder. You get more bone spurs. Some of those bone spurs can cut into the muscles and shred the muscles and make it even harder or sometimes impossible to get as good as you did before. But it actually turns out that getting surgery when it's the right time and not waiting too long really gets the best outcome. And some of those patients have now waited just a little bit too long.
So beyond surgery, we talked about the sedentary lifestyle. What do you recommend for people at home that maybe have arthritis and some joint pain?
First and most importantly, get moving. Some of us are working from home now, and that's made it all the worse. We're not getting up, we're not getting moving, we're not going out and getting to work. So just get moving is the most important thing. Get back to some activity, try to lose some of that weight you might have gained. And then 2 is we're open. Orthopedic surgeons, medicine is open throughout the United States. Go see someone. It is very safe. We've all been vaccinated. It's very safe. See someone who can get you the right treatment, whether that be medication, injections, or surgery.
And when you say get moving, I'm assuming that even just a little bit, starting with a short walk can even help. Getting off the couch would help.
It is, you know, 100 steps, and 100 steps is 1,000 steps, and you do that all day long, you got 10,000, maybe even 20 or 30,000. Suddenly, you're getting active again. But even 100 to start is better than nothing.
Yeah. Maybe once in a while I take the stairs instead of the elevator here at work. Makes a little difference. I want to let people know. Yeah, they can go to hipandknee.com. Is that your website? Outpatient.
Yeah, outpatient and hip and knee. We do outpatient surgery, so patients are better, faster, can get home the day of surgery and get back to their life.
All right, outpatienthipandknee.com for more. Richard Berger, thank you so much for being with us today.
Thank you for having me.